next guests say alcoholism is a complex brain disease and not just a weakness or moral failing. That's why, unlike other rehab treatment centers, they use medicine as a form of treatment.
That's right. It is unique and has even been featured on the show, The Doctors. And joining us now with more on the Fresh Start Recovery Program is the medical director, Dr. George Falieras. How are you, George?
I'm doing
Come
great.
on over here.
Hello.
Scoot over toward us a little bit more because, yes, that's perfect. It's good to have you here. Thank you.
Thanks for having me. It's a pleasure.
This is a very unique program. How is it different from other treatment programs, Doctor?
So like you said, we recognize, and there's really no ambiguity in the addiction community, that all addictions, but alcoholism, which is the most prevalent, is a complex multifactorial disease of the brain. And there's two components in order to treat that. The psychosocial component, which is exquisitely important, and the physiological component, which requires pharmacology or medicines. Most conventional programs only address the psychosocial. There's, any kind of treatment you can imagine, psychotherapy, individual therapy, group settings, residential, that's all available for people. But what many people don't succeed because they can't overcome these arduous, overwhelming, intrusive, compulsive cravings to drink, which tether people to their addiction. We utilize a medicine that eliminates or significantly reduces those cravings. What's different and what we use is that this medicine's been around for quite a while. Medicine's been around for a while in the pill form, but it simply doesn't work because patients aren't compliant with the medicine. But we use a subcutaneous implant, which we surgically place in a very small procedure, and it slowly releases the medicine for many, many months. And so it removes that variable of compliance from the patients. They're relieved from their cravings, and then they can focus and be receptive and be present to the teachings of their counselors, their therapists, 12-step programs, etc.
So what exactly is this medicine, and are there any negative side effects?
The medicine's very well tolerated. The medicine is called naltrexone. Like I said, it's been FDA approved in the treatment of alcoholism for over 20 years. It's hardly ever used, which we've been doing a disservice to alcoholics, but it's only been available for all these years in the pill form. It also recently became available in the injectable form, but you have to get your injections every 3 to 4 weeks. Patients are not compliant with their medicines. They don't take it. And an alcoholic in the throes of an addiction will not take his medicine every day. The medicine's very well tolerated. There's not many side effects.
Why haven't we seen this before used in such a manner? This type of medicine used in the manner that you're using it now for alcoholism?
It's a great question, and no one really has a good answer for it. It's just, anyone can tell you, it's simple, that an alcoholic who is destroying his own life physically, mentally, spiritually, emotionally, destroying the life of his family, of his children, it's not that's why Just Say No doesn't work. They're not enjoying themselves. They desperately want to quit. They're suffering, but they can't. It's because there's a major dysfunction and imbalance in the neurotransmitters and these receptors and that dopamine reinforcement pleasure loop, right? So by providing medicine that blocks that reinforcing pleasure effects of whatever addiction it is, we're talking alcoholism, by blocking that, they're not ravaged by these cravings. They can then focus on obtaining the tools to deal with triggers and stressors down the road, which will happen. This is not a magic bullet, and there is no cure. And people need lifelong maintenance and attention. We employ a one-on-one intensive counseling, life coaching program to help people deal with the life stressors. And our patients are able to focus on that and be present for that because they're not ravaged by the cravings. But we want all of our patients to get lifelong maintenance, whether it's 12-step programs, of course AA, or whatever they're most comfortable with. Because down the road, because they do have this disease, and they're at risk for slipping back in years down the road. So it requires lifelong maintenance. But in those first 6 months, which are the most critical, where those neurotransmitters are out of whack, where they're ravaged by these overwhelming urges to drink, we can remove those.
So how would you compare your program's success rate with other more traditional programs?
There's never been a number of big papers published on that, and no one really wants that information out. I can tell you that the success rates are very low. And it's hard to say these big groups and these big centers don't keep records.
What's your success rate is what we're trying to ask as well.
Our success rate has been very good. We've reported 85% success rate. Now that is just on calling the patients and following up year
Just
after a year.
self-reporting.
Right, but it's very promising. It's much better than anything you'll find in the literature. Now, is that going to be the same 2, 3, 4, 5 years down the road? Was this a double-blinded trial? No, it was just us talking to our patients. But I can tell you that most of our patients do exceedingly well, and it's a very hopeful, and it's really exciting.
Yeah.
You seem extremely passionate about this. Did you have any personal experience, or why did you want to get into this kind of work?
I have a number of close family members and friends that suffer from alcoholism, and since I've been involved in this, you realize nobody doesn't. Nobody. There's not a person on earth that doesn't have a family member, a dear friend, a colleague, an uncle, someone that's affected by alcoholism. And one of the things that my mission is to remove the social stigma, increase the awareness, increase the access for people to get treatment, because it is not just a moral failing, it's not just a weakness. Alcoholics need to take some personal responsibility, and it's a hard, arduous journey. But in addition to bad choices, they're also suffering from a disease that the three of us don't have. Now, I also work in the emergency room, I work in the hospital, in the ICU, and I have for years in the inner city just seen alcoholic after alcoholic after alcoholic. Some journals say that it's the 3rd leading cause of death in our country. I can tell you, in the emergency room, if nobody drank or did drugs, our visits would be like, the ERs would be empty.
Yeah.
It's just alcoholics and accidents and all the things that alcoholism causes. And we've never had a suitable option. All these patients that even if they have to go through detox and we discharge, we just discharge them and say, here's information to follow up with AA. And AA is great, but it's kind of like, this is a chronic disease like blood pressure, like diabetes.
That needs to be treated with medicine. And I know that you're receiving national attention as well. You were on a national talk show, The Doctors, and you had great response with that. And you're also getting great response from some of your patients, which we have standing by. So we are going to come back with the doctor, and we're going to talk to an actual patient when we come back, who actually went through the Fresh Start Recovery Program. Talk to him about what it has done for him. We'll be right back.
KC24 brings you a lifestyle show from Women You Know with Alex Delgado and Lindsay Pena. Now Central Valley Today.
If you're just tuning in, we've been talking about the Start Fresh Recovery Program that's helped hundreds beat their addiction, but it isn't your usual treatment.
That's right. Joining us once again is the medical director of the program, Dr. George Faliaris. Is that right, how I said that, doctor?
Beautiful.
And then we have Todd McMiniman.
Close enough.
Close enough. Oh gosh, Todd, say it for me. I practiced
McMiniman.
McMiniman. And he's a patient, a recovering alcoholic as well. Before we continue, we had it on the screen as Fresh Start, but it's Start Fresh.
I know it's confusing, right?
So it's a
Start Fresh Recovery.
Okay, Start Fresh Recovery. Doctor, tell us a little bit about how this program started here in Fresno, and then we're going to talk to Todd real quick.
Actually, the implant that we use that releases this medicine for 6 to 10 to 12 months, we're the first people to bring this long-lasting implant to America. And a guy whose wife was a very bad alcoholic for a number of years, failed everything. In Australia, went through a similar program, and this was successful for her. He was so enthused, which a number of our patients are, so he somehow negotiated the rights to distribute this thing worldwide. So he brought the company that distributes the implant. I have the medical clinics that use it, and he brought it to the company's called BioCorrex, and he brought it to Southern California. So we're expanding rapidly. We have one in Southern California. We've just opened one in Walnut Creek in Northern California. Eventually, soon hope to open one in Fresno, and we're opening in different cities across the country.
Got it. But you can find a lot of information on the website, obviously.
That's right.
Start Fresh.
So Todd, you have gone through the Start Fresh program. Just talk to us a little bit about how it turned your life around and how it changed things for you.
I've tried so much throughout the last several years, and nothing worked. And I'm just so fortunate to have met the great group, Start Fresh, and it was dialed in directly to what I needed. Supportive, positive, and this is without, the magnitude of just how powerful the implant was and how powerful it is with the one-on-one coach and the support I get there too. It's very mind-blowing.
Did it really stop the cravings? Because that's what it's intended to do, this medicine, right?
As tough as it is to describe, the word that comes up most is surreal. It's surreal. Not one single inclination to drink, not one craving whatsoever.
Were you skeptical when you heard what he was doing?
I guess I wasn't in a sense that I was so excited to change. I was so excited to just get back to who I was. I mean, this is who I am for the first 40 years of my life, and then to be in such a low place. I was so excited I would have tried everything, and then when I met them, it just made me feel so comforted. It didn't dawn on me until a few hours afterwards when I made it home. And of course, my place looked like, it made a fraternity house after a wild party look like something out of Architectural Digest. It was, oh my gosh. Wow. And I methodically went through, cleaned the whole place up, sorted the mail, and it dawned on me, I didn't think about drinking once. And this is a few hours after the surgery.
We were taking a look at some of the videos from your website, and how did you find out about, I know that you were introduced to somebody, but when you first started, how long before you decided, okay, no more drinking? Like, that's it, I'm done. And how long has it been since you stopped?
It was as soon as someone had actually called my parents first.
Okay.
And introduced them to it. It was through my ex-wife to my parents and then to me. As soon as I heard about it, I said, great, whatever, just get me going. Tell me what I need to do.
And how long have you been sober?
God, I think December 8th.
Wow.
I think it was December 8th.
We start the program by, when people need it, require it, we detox them. So Todd was still drinking heavy, and if you look at the footage from the doctor show that Todd was on as well, we do a bottle of rum, a big handle of rum a day.
A 750 milliliter bottle of rum, more than that a day.
Okay, so you would wake up and decide you needed to take that drink in order to function?
All day.
Okay, are these the kind of people that you're looking for, doctor? I mean, what are some of the requirements of people that can take this drug, or what do they need?
Our patients run the gamut, and we're welcome to anyone. The responsibility of the patient, the requirement to be eligible is you have to want to quit. Okay. People bring the family members, they bring their husbands, and if they're not ready to quit, and sometimes people want to quit, but that's not good enough. If they want to quit, then we can provide them help. And we have patients like Todd that are in absolutely awful shape, that are drinking from the minute they wake up till they fall asleep, and sometime at 4 in the morning to put them back to bed. We have other people that are very high functioning, CEOs, still maintain a good job, but the minute 5 o'clock hits or 6 o'clock, they're home, they're drinking. It may be a six-pack, it may be 6 to 8 drinks, it may be 2 bottles of wine, but they've been doing this for 10, 15 years. And despite being able to maintain a semblance of control and be successful financially, etc., they realize they're not living up to their potential. They haven't cultivated all of their talents. They can't be the father, the husband that they want to be. And they're done with drinking, but they can't stop.
So last question, how much does this all cost? And what if people can't afford it? Are there ways for them to still get treatment?
Right, and that's one part. I'm the doctor, not the finance part. Yeah. So, but I can tell you that we work with everybody. A number of insurance providers are covering at least a portion of it. And then we have programs for financial hardship. Our program is certainly competitive and less expensive than most of these residential facilities and these types of things. We do have to purchase, our clinic has to purchase the implant and the program and all this from the company that sells it. So it's not free, of course. And you have to have some skin in the game, but we want everyone to be able to go through. And we finance people, we do the financial hardship, we make payments tolerable, we do what we can to get people through.
I'm sure it's changed, obviously, your life around, and you're going to continue with the program.
December was the most transformative year in my life. I had no idea that could have happened.
Wow. Well, congratulations to you. I know that must be so difficult. Congratulations. And thank you, doctor, for bringing this to our viewers. And the website, it's been flashing on your screen. The first segment, we had it reversed. Fresh Start, but it's actually startfreshrecovery.com. Look it up online, and you can also call the number that you've seen on your screen there as well. So it's quite a remarkable thing, and I know you work with all sorts of patients. Thanks. Thank you so very much for being here.
Thank you guys very much. I really appreciate it.
Thanks, Doc.
Appreciate it. Bye-bye. All right.